Welcome back to Holistic Healing Association. I'm Erin Darcy. I am certified in embodied processing, which is somatic processing, and certified in clinical hypnosis. Today, we'll be discussing post-traumatic emotions. Post-traumatic emotions are emotions we experience after a traumatic event, which could be toxic shame, anxiety, sadness, anger, deep grief, guilt, emotional numbness, and detachment from others. Today I have with me Dr. Sonia, who's a clinical psychologist, and Dr. Peter Levine's head trainer. She is certified in somatic experiencing. Thank you so much for joining us, and can you please tell us a little bit about yourself?
Oh, thank you very much for this moment that you are introducing me. And it's a big pleasure to me to be here to answer your questions. I'm not sure if I'm going to exactly answer what you're expecting, but I only can say about my experience. I'm working 26 years since the first round of Peter Levine. Peter Levine, a creator of somatic experiencing trainings. And I have my first class in 1989. We started. And I finished in 2000. But in 1999, I started to really to cooperate with Peter Levine in the first instance. And he used to come to Brazil for 13 years straight. And I was his big support to expand SE in all over of Brazil, north, south, middle, and it is still my great, pleasure to work in that cooperation of this great approach to help people on their trauma healings. So it's a lot of I have been gained with that approach, and I turn on all my life when I heard Peter Levine says and talk about trauma. Was straight identification with what Peter Levine was saying. He was my first master.
That's
In that
amazing.
level. Is in that level, and was the first love. First love, and I said, "Oh, hello, Sonia. This is what you're born for." So, and since that moment, I left over everything that I was doing. That time, I was more connected with the chronic pain because I was working in the chronic biggest hospital in Latin America, even the central, in the big hospital, clinical hospital related to the biggest university in São Paulo, from that chronic pain. I was working with the biggest and most important doctors that was working with chronic pain from University of São Paulo. It means São Paulo University. This is the moment that I met Peter when I was involved with that project in São Paulo. Now I live in the northeast of Brazil, but when I met Peter, I was very involved with chronic pain. So we work with children, we work with youths, and we work with adults. That was the moment that I started to meet and be involved with somatic experiencing. Peter Levine didn't call somatic experiencing that time he didn't put the name Somatic Experiencing.
What did he use the name?
He used workshops in boundaries, workshops for bodies, body
Interesting.
workers.
That I didn't know. So he didn't have the name Somatic Experiencing when he first started.
No, when he started, no. There is a first round that still we have some of them working with that. That was Raja Selvan, Lael, and Diana Heller. So, and me. So we are the first ones that started to go around.
Amazing. What is the science behind it?
Oh, the science behind of that is that the body need to feel stable, and how you can use the post-traumatic stress and helping people to really to find where they live. It's not in the mind, but the sensations and emotions are experiencing through body, not through mind. And in general, all the articles in the psychology gave so much attention in our cognition. And Peter brought that amazing topic and bring our attention that is where the experience in the body that brings to us the possibility to change. So the possibility to access the information that the organs brings to our body to experience and to be understood what our mind understand what the body is experiencing. So this is where we start. So
Because trauma is held in the body.
traumas is experiencing in the body, but interferes in our cognition, in our actions, because emotions, it lives in our whole body. Emotions is emotions, is the movements that the body and its physiology process in the body. So continuous emotions mean our body moves, our body is not static. So, and when we as a rover started to, we understand that there is a X, there is a X that we need to find for us to feel stable in life, because we live here in the earth, and the gravity, there is implication in our actions, in our emotions, and
Makes sense.
yeah. So as much as you are in your X, as much as you are understanding and experiencing your contralaterality, you're going to feel much more as a human being that lives upright. So as a biped, we need to experience our life and continue our evolution process coming from quadrupeds, and has all the process when the baby starts, to move, and the direction in the evolution is for us to feel upright. So in bipeds, as
Because it's
we
true.
move
Because even like
side,
when we're feeling bad, our shoulders can go down. Our bodies make movements, right? When we're feeling confident, or we hold our shoulders up high, like I feel good. And you can tell when you're looking at people how they're like maybe shrunk down, and that may can see it be a sign of low confidence.
why?
And
Because
That's
your
emotion.
trunk,
That's in the body.
yeah, because your upper part of your thorax, when you are feeling not comfortable or not safe, you have a tendency, like you said, to inclinate it. And when you inclinate, all your thorax compress our, digestion. So what you feel and what you know about balance means that for homeostatic function to work properly, we need to have our homeostatic functioning well.
As a clinical psychologist, you're saying somatic processing can help us with our emotions, can help us process our emotions with anxiety, depression, toxic shame. It can help people with addictions, eating disorders, suicidal
That,
thoughts, you name it.
yes. First of all, our principal goals is to help the person to feel safe on their bodies, to feel safe that, for example, now I'm feeling safe because I have the support of that chair, also in my pelvis as well in my, back. So also I'm looking at you. I can see your expression. So the way that you talk to me, I'm going to feel safe or unsafe. This is the base of what Porges brought to us, Stephen Porges. So I'm very connected with Stephen Porges and his wife, Sue Carter. I have been very good friends of them, and I sometimes teaching a Polyvagal Institute in Florida, or others conference that we use it to do.
Okay, well, thank you.
They are suffering with their anxiety. So first of all, I teach them how they can find something that they can touch the sole of their feet and something that they can press. For example, you can press your feet against the floor and we can access their cortex, or we can access their emotional body, emotional brain. So, for example, I'm giving as a suggestion for people that need to regulate themselves. Regulation means that you are breathing properly and you are with your connection with the medial prefrontal cortex, and not only with the 2.5 spoons of cognition cells, So if you bring your attention to the middle of your medial prefrontal cortex, you have connection in the brain with your amygdala, that is emotional brain. If you are only connected with your cognition brain, so you are connecting only with your mind. There are people that are mind, they're cutted, the head, and they do not feel the rest of their bodies. So the first thing that is that we can teach people primary to sense a connection between mind and body. So playing with that small movement, so you connect it with the posterior part and connect with the mind. It means that is sympathetic connection. If you come to your calcaneum, so you're going to connect with anterior part of your body. It means your organs, your heart and lungs, and you're going to connect with your emotional brain.
And I
So
believe embodied processing. I believe it's very similar to somatic experiencing. I've been trying to figure out what the difference is. We all use movement. We all use breath work. We use processing our emotions. We are going back into the body, parts work, neuroscience, polyvagal theory from your friend, Dr. Stephen Porges, internal family systems, and attachment theory.
Yeah.
It's rooted
Mhm.
in the wisdom of everyone
Mhm.
you just spoke about, right? Yourself,
Mhm.
Dr. Stephen Porges, Dr. Peter Levine, Dr.
That's so wonderful.
Dana, like it's amazing. You guys are amazing. I believe it's it's all these different types of somatics. They're all like sisters. They're all very, very similar. They're just very minor differences. Would you agree with that?
Of course. We are
Yeah.
looking for bringing more and more consciousness for people to step in the pathway that bring them more, ability to live in the earth, because it's not easy to live in the earth. So if a person keep with that, you know, um, grief for a long time, they are not helping the freedom of those one that are in another state. So, the person that keep alive, needed to really to relieve, and give it back to who create us, because if you believe, the God knows more than us.
I
When
agree.
is the
God,
dead?
yes, I agree. God does know more. And sometimes we don't understand everything, but we just need to trust. And that can be hard sometimes, especially like even looking at what just happened in Texas and trying to understand and comprehend how that can be allowed, how God could allow that to happen. But we don't understand everything. And
No.
you know, I like we just need to do our own healing work and
And
do the best we personally can. And I agree too. I do believe there's an afterlife. I personally believe there's a heaven. And we will be united with our loved ones again and be at peace. And there will be no more suffering.
for that, you need to increase our faith.
Yes,
This
I
is
agree.
something very difficult to people to accept, is the faith,
Yeah.
you know?
And there's going to be
And
many trials in our life because we're human, and that can be part of life is suffering, but we need to go through the suffering. And when we go through the suffering, that's how we're able to heal and we can learn. If we push down the pain, which many of us do, I know personally I have as well, because we don't want to feel it, the suffering can get louder and louder and louder. And we can try and push down our emotions through addictions. And addictions, people think, oh, drug and alcohol, but there's working addictions, there's social media addictions, there's cell phone addictions, there's many different addictions. Some are praised and some are shunned, but it all comes from the same place, pain. And if we can process our emotions and allow ourselves to be where we're at the time and meet ourselves where we're at and have compassion for ourselves and others, we're going to
amazing.
be able to heal. And it's also about connection.
You are so wonderful, Eddie Darcy. I
Thank
had
you.
experience. I had experience with a very wisdom person that I have a deep respect to her. She is the Porges wife. Her name is Sue Carter. She's one of the most intelligent person that I met in this life. And I had the opportunity to spend weeks with them now, traveling in the civilization. She said, Sonia, sometimes she called me Sonia, I'm going to take you to, to meet where the civilization starts. So this was the experience we had about 1.5 months ago, more or less Yeah, I forgot that.
You guys are close if you're traveling together.
Oh, yeah. Yeah, because life puts us together. She's wonderful. She knows a lot. I could not leave her because I want to be close to her because she's amazing. She's really intelligent, and I have learned a lot these days with them.
Okay, well, thank you so much for joining, and thank you, everyone. If you'd like to like and subscribe to our channel, that would be great. And comment below if you have any questions.
Thank you very much for that opportunity, and a big pleasure to meet you and have this talk.
It was an honor.
Thank you.
Thank you.